Welcome, part 4 in our ongoing series, Rising Practices and Policies Revisited. In this whole series, it's really been focused on emerging priorities in mental and school mental health. Today's session is the woes and wonders of recruitment and retention. I want to kind of look back at all the 4 sessions that we've had so far, which has spanned 4 topic areas that we heard most from you all within our network to be an interest. Session 1 was about the 988 National Helpline. Session 2 was really looking at uplifting supports and strengths for refugees from war. Session 3 focused on supporting unhoused people and students. And then for our last session, we're really looking at the recruitment and retention issues within the workforce and what we can do about it. So with that, let me pass it off to Dr. Tanisha Freeman Foster.
In each session, we've built upon, I feel like it has led us to this place. So we talked about wellness, we talked about community wellness and how we can help to serve youth and young adults. In order to be able to do that effectively, we have to have a workforce. And so this session will focus on not only increasing the workforce, but engaging with people. How do we engage with individuals in a way that supports them in even wanting to come to work at our mental health agencies and at our mental health institutions, and also thrive in their roles. And so this session, we will discuss that. How do we address and share strategies for addressing school and mental health workforce shortages? So during this session, we're going to talk about the disparities between what the field needs in providers and service systems and what trained professionals are able to provide. Also, we're going to look at how might we onboard and retain a new wave of providers. We know that what individuals are looking for has changed tremendously, and in some ways has not. I think people have a new lease on life, if that's the correct term, since COVID, that being respected at work, being valued, having a flexible work schedule, and being able to spend time with their loved ones, and also self-care have become very important. And so how do we make sure that we take care of our first customers, which are our staff, so that they can better take care of young people and their families and communities and individuals as they navigate school. And so we know that based on data that are often disparities in the number of Black, Brown, and Indigenous men and women who are providing mental health. So we're going to talk a little bit about that today. How do we, again, recruit and retain and engage with these individuals so that we can have a diverse mental health workforce where people are able to come in and request and receive services from people who look like them and who understand their experiences. We're also going to look at how can we create a sort of like a pipeline for middle school and high school students so that they're aware of mental health as a career opportunity, so that they can learn more about that while they're in school and explore those options to advance our workforce. And then we're going to talk about an action or strategy that our panelists would recommend. And so based on their experiences and based on their lessons learned, they're going to share some of their thoughts and ideas around recruitment and retention. Meeting today's panelists. So we are very excited again to have our panelists who have graciously shared their time with us for this session. And also after this session, if you're able to stay, we're going to have a little after party, a question and answer networking session. So we ask that if you're able to, please stay. And so our first panelist for today is Dr. Katie Dockweiler. Then we have Dr. Patrick Kamanyagan, and my apologies if I messed your name up. And then we have Miss Russia Collins, who again are going to share with us their experiences in working with young people and working with schools and working with their local communities. All right, so without further ado, I am going to introduce you to Dr. Katie.
Thank you, Dr. Freeman Foster. As mentioned, my name is Dr. Katie Dockweiler, and I am an assistant professor of school psychology at Nevada State University. And prior to working in higher education, I worked as a practicing school psychologist in the Clark County School District, which is largely the Las Vegas Valley here in Nevada. And during that time, I also had the incredible opportunity of serving on the Nevada State Board of Education. And I'm currently in my 5th year in that role and serving as the vice president of the board. So the various perspectives and lenses that I bring to this work come from as a practitioner, as a higher education professional, and then also as a policymaker and researcher. Throughout all of this, the work that we're engaging in, it's very important that we use intentional approaches. Especially in the school setting, I think that we tend to be very of the mindset that we're a school, we're working in school setting, and that's really our lane. But what's important is that we don't function all by ourselves, right? So we have the community that surrounds us, we have policies that impact us, and so really working to identify who shares in with these different pieces so that we can be as impactful as possible. So at Nevada State University, we are working to build a pipeline of school-based mental health professionals. And in our particular space, we're working on our school psychology students. And as a whole, we've really had to identify as a state, we had to evaluate programmatic policy and financial needs, and working with a variety of different groups invested in this, working with our legislators, working with the different financial pieces. It's really been impactful in that we've been able to create the type of systemic change that's needed for workforce development and training. It's not enough to say we don't have enough. Okay, well, why not? We need to ask those questions. Why, who, what happens next? And it's not only one layer, it's often multiple layers of questioning that we need to go down. So we need to make connections with people outside of our silo to make sure that we can have more voices to amplify what we're attempting to do. And then we can share those voices with the decision makers who need to hear them. This is especially important in the program that we're working on. Nevada State University is a Hispanic serving institution, and school psychologists nationally, in Nevada is really no different, are 96% white, whereas our student body is, you can see here, 44% Hispanic and 29% white, 10% Black. So there's definitely not the representation that we need in our community. So one of the ways that we're working on that through a financial lens is through the Federal Mental Health Services Service Professional Demonstration Grant through the U.S. Department of Education, and we're prioritizing and incentivizing the recruitment and training of diverse school-based mental health providers, because we want our practitioners to represent and look like the communities in which they come from. And we're working on this pipeline high school through graduate school, and to increase the number of these high quality trained diverse providers in Clark County School District, but then also throughout the state as well. So the approach that we're using through the different policy pieces that have passed through the legislature, so through statute and then through regulation, and then also through local policy boards, we're addressing training programs. So we're working on access. We want to create spaces where our students can actually access the programs that our communities need. Workforce development is essential to creating the types of professionals that are needed in our state. So certainly doing a needs analysis is part of that work. Identifying policy priorities and disparities. Once we've identified what we need, what policies can we put in place at all those different levels to support the work that we're doing, and then reinforce that. Oftentimes what's put into policy comes with some financial benefits and some financial supports. So considering the funding that goes along with the whole big picture is important. And the Artery Pipeline Program, it's an acronym for the Active Recruitment, Training, and Educator Retention to Serve Our Youth. And the piece of this that I really want to stress is the active component, the A, the very beginning. It's so important because it's not something that you can decide or agree upon and then put it on a shelf and just assume that everything's being implemented as intended. It's a constant moving ship that needs to be guided. And it incorporates all different pieces of the things that we're talking about today, the recruitment, the training, and the retention. So you'll see our little logo here with the different colors, starting with our dual credit high school students. And really even before that, going into our middle schools and doing awareness campaign. What is a school social worker? What is a school psychologist? What is a school counselor? How do they work together? How are their roles unique? And really creating that awareness for our students at a very young age so that they choose these professions. Oftentimes, students don't even hear about these professions. And if they do, it's not until they're in college or a parent themselves, and then they have a child who's referred to one of these professionals. So really making students aware of these professions and making them a profession of choice. And then also one of the things that's unique about the programming, this type of approach, we're creating these stacked degrees and then also offering multiple entry and exit points. So through a minor in school-based mental health, students can then be qualified to become school psychology assistants. And this is a novel approach really to help support licensed practitioners, so school psychologists, with a lot of the paperwork aspects, a lot of the scheduling, really so that it frees up school psychologists so they can work with our target population, our students, and not working on paperwork. And then it also creates that pipeline where those individuals who are interested in school psychology and working as assistants can come back and receive training through our graduate program in school psychology, and then go out and enter the field as licensed practitioners. So it's definitely a very connected and, as previously mentioned, intentional approach to every step of the pipeline. Putting this slide deck together, it was about 115 degrees. And so snowmen seemed like a very, very fun thing that was very inviting at the time. So it made me think of snowflakes. And we are all one little piece, but we can do so much. And together we can accomplish even more. So don't be afraid to just start. Pick one little piece, whether it be a policy, be it practice, be a ratio, be a conversation, and really start working with that piece and having those conversations, conducting needs analyses. And really you can amplify the work. And it's important because we're not alone. We are part of a community, we're part of a school, and we can make those things happen together. Also starting to think differently in the school system, since we're talking about school psychologists specifically, about ratios and workforce needs. So the nationally recommended ratio for school psychologists is 1 to 500. And a lot of our districts, they allocate positions, say, for example, 1 to 2,000 or 1 to 1,000, which is not near the ratio of 1 to 500 that's recommended. So when we're talking about our staffing shortages, it's not enough to just look at it in comparison to how many openings a district has, but use that 1 to 500 ratio and compare that, and then think about how many positions you would need based on that number. So the true versus the reported shortage. And just to wrap it up here, I would also consider the role of higher education in the training aspects, because schools can't hire practitioners who aren't trained or don't exist. And then think about supporting policies and frameworks such as the Artery that can support this work as well.
Thank you so much, Doc Weiler, for sharing that with us and really putting that emphasis on the Artery program and the A in the Artery program being active, finding a place to just start, and also remembering the community, breaking down those silos and coming together with people who are doing similar work and engaging them in the process. And I love that you all start with middle school and increasing awareness of mental health and the careers that are associated with mental health, and piquing the interests of young people while they're still in school. So thank you for the work that you're doing. So our next presenter for today is Dr. Patrick Kamalyagan. And again, forgive me if I'm pronouncing this wrong, but thank you so much for your time and your participation in this session today.
Thank you so much, Tanisha. Hello, everyone. Good afternoon. Thank you so much for being here. Thank you to Ingrid and Ida and Tanisha for all your hospitality. My name is Patrick Kamalyagan. I am a professor and program coordinator of the Urban Education and Social Justice Program at the University of San Francisco. My work is informed, is informed by my desire to become the type of teacher and the type of teacher of teachers that I wish I had prior to hating school in the second grade as early as 7 years old, and also informed by me being pushed out in the 10th grade as a 15-year-old. My work as a teacher educator, teacher of teachers, and as a program coordinator is also informed by my teaching in LA Unified for 10 years, my teaching in Oakland Unified for 6 years, and for the last 10 years, I've been teaching high school 16-year-olds in a class called Critical Issues in Education. So my work as a teacher educator, as a teacher of teachers, I've been doing for about 16 years. This is where I've been able to develop, apply, and analyze my practice. The title of my presentation is Making Graduate Programs Our Own. It's a response to the many critically conscious students and teachers who find themselves disappointed with the social hostility that they are faced with when they either come into graduate programs or when they take positions at their institutions. One innovative way that I think graduate school programs, next slide, can create, incentivize, and certify workforce diversity has to focus on improving the intersectional climate of our profession and our graduate programs, right? The intersectional climate has to be welcoming, and it has to celebrate Black, Indigenous, people of color, queer and trans folk. It has to celebrate and welcome disabled, neurodivergent, poor, working class, and migrant communities, right? Intersectionally, we have to improve the intersectional climate of our programs. Our purpose should not be to simply get people in the door to increase diversity in the status quo. Princeton sociologist Ruha Benjamin reminds us that too often DEI work, especially at universities, is too often metaphorically akin to this burning building that we're clamoring to get people into. So using that metaphor, the first thing we need to do in that regard is smell the smoke, right? So programs say they want diversity until and then that critical intersectional diversity shows up. But if we aren't doing anything to make our programs safe, then we're responsible for compounding much of the social trauma that's intensified by socially toxic spaces that are hostile to the humanity of multiply marginalized people. People who are marginalized racially and or in terms of gender, sexual orientation, economic access, physical or physical ability, so on and so forth, right? So with many critically diverse students, there's often a type of righteous indignation that is misread as unprofessional, inconsiderate, and non-collegial, right? They are then treated and viewed as a problem versus as people deeply impacted by and seeking desperately to solve it. So then the programs, the instructors will get frustrated when intersectionally diverse students or teachers will push back on problematic statements made by those with the most privilege. And then those who have the most privilege will name this supposed lack of collegiality as hostile, as harmful, and unwarranted. But Zeus Leonardo and Ronald Porter, educational scholars, will refer to this phenomenon of creating safe spaces as violent, because it requires these safe spaces really require multiply marginalized people to be maladjusted to their suffering so that we could protect the emotional fragility of those who have the most privilege. For this reason, we need to hire BIPOC as first responders to this toxicity. Hiring critically conscious BIPOC can help ensure a diverse, well-prepared group of faculty, especially ones that embody the intersectional identities that multiply marginalized students identify with. At our program at the University of San Francisco, in a profession that's 86% white, this is a picture of some of the instructors I was able to identify in the community, recruit, hire, support, and mentor who embody the intersectional identities that we should try to recruit to our programs, who also resemble the demographic that we want to serve more effectively in the field. They are well respected in the community and a cultural match for critically diverse graduate students because and students in the community because they make a high impact on their mental health. They increase their cultural esteem and improve their academic learning. But in my hiring, I also want to make sure that our teacher educators have evidence of experience teaching both equity and excellence in schools, right? As the saying goes, not all skin folk are kinfolk, right? We need to be more than diverse to be effective. So do we have evidence of both equity and excellence in our practice? And so the process of increasing diversity of instructors, I found, often gets met with contestations. It's what I think of as the hegemony of hiring. And this requires that we mediate this strategically and we advocate for hiring intersectionally diverse faculty in really principled ways. But yet and still, increasing the intersectional diversity in our programs through our instructors does not guarantee harmony in our classes. Thus, we need to always help who we hire put out the fires. Even BIPOC instructors, intersectionally diverse BIPOC instructors, have difficulty holding space for those who are most resistant to social change and those who are most vulnerable to injustice, right? Because these tend to be really highly combustible classroom and professional contexts. So putting out fires require supporting instructors in their ability to hold space across perceived differences so that we model to our students, the instructors will model for our students how to be effective teachers of their students, especially those who have the least. But when students with the most privilege say problematic things or share deficit perspectives, most teacher educators, most professors often will placate to those with the most privilege, right? They don't address white, male, like ableist innocence, and they oftentimes fold under the pressure of fragility and tears. So this compounds a lot of the toxic stress that I mentioned intersectionally diverse BIPOC teachers, students, grad students, and professionals have that I mentioned prior. So additionally, when teachers of teachers lack the experience and know-how to hold space for those with conflicting points of view, students and even instructors with different privilege, they feel implicated whenever multiply marginalized students will articulate their experience navigating social oppression. And so this requires that we teach all our students, even our instructors, to learn to be critically comfortable in their discomfort. This is what Kevin Kumashiro will call learning through crisis. Learning through crisis allows fragility and conformity to transform itself into community-centered social compassion. this isn't something that only benefits BIPOC students, right? There's this assumption that increasing diversity in our programs or our university only benefit people of color, or mostly benefit people of color. But if you look at the 2008 Harvard Ed Review study looking at campus diversity and cross-cultural workforce competencies, it found that white students exposed to cultural diversity in college, and then by extension, graduate school, also benefit in their ability to work with different populations. It improves their critical thinking and communication skills, and increases their chances to earn more and access a higher quality of life. So in essence, all of this speaks to the importance of improving the intersectional climate of our programs.
Thank you so much, Dr. Kamayan, for sharing this with us and your program on making graduate programs our own, and really speaking to the foundation of this, improving intersectional climate, and starting with creating a foundation for that. What type of foundation are we creating within our schools, within our workplaces, that allow us, as you say, to celebrate and welcome intersectionally diverse students, staff, and faculty, and the importance of that, and breaking down and almost preparing for the distension and the discomfort that will come in the classroom, and also I think laying it out so clearly around how, if we do this correctly, it can move us forward as we're working with young people, as not only in school, but as they enter into the workforce and working with diverse populations. So thank you for speaking to that, and thank you for the work that you are doing as a teacher of teachers. So last but not least, I would like to introduce our next speaker, Miss Russia Collins.
I am Russia Collins. I'm a licensed mental health counselor, qualified supervisor. I'm the owner of Collins Consulting. And in that, I provide consultation and supervision to individuals who are seeking clinical licensure, and also to organizations in an effort to improve equitable practices. I'm also the clinical and training director for the University of South Florida, with a focus of infant mental health at our Infant Family Center, where I supervise a team of clinicians who are providing infant mental health therapy and dyadic work with families. And I also serve as a member and chair for the Well for Life, which is a BIPOC led organization, behavioral health organization here in St. Petersburg, Florida. So I'm so excited to be part of this conversation today as we look at recruitment, retention, and disparities within the field. Okay, so one of the first things I wanted to talk about is that early engagement piece, the engagement of middle school and high school students as a means to promote viability in the mental health field. On the right, I always, what I didn't share is that I am a mom. And so that is a very important identity for me. But on the right, I do have a picture of my son and my niece. And the reason that this photo resonated with me for the purpose of today is that in his hand, this was his 8th grade project. So as we talk about middle school engagement, he's now in the 10th grade, but this was his 8th grade project. And throughout the year, they had to think of something that would be meaningful to them as their full year project. And then they had to talk about it at the end of the year. And he's handing her a positive affirmation. And it says, "I am allowed to feel proud of myself." The reason this stood out to me is because when I asked him what led him to take on passing out and posting and putting up positive affirmations around the school, he said that it was an attempt to improve the mental health and well-being of students on the campus. And I asked, well, what led you to do that? And his answer was that he sees me do this type of work all the time. And so it was an important thing he thought he could do at his school. And so that really resonated with me, because it's all the things that are happening while we don't know our children are watching. And so my first point is that children learn through exposure and parental influence. So as we're thinking about what are some of the things that would engage middle and high school students to even think about having a field in social work or mental health, exposure is going to be critical. Participation and representation in school career days. As professionals in the field, it's important that we reach back and insert ourselves into the school settings. Much of what children learn to be possibilities, it's sometimes as simple as having representation that has shown up and talked a little bit about the work. And so opportunities to do that could be something as simple as a school career day, where you start to spark that interest in the minds of young people. Incorporating peer-led mediation and social and emotional support groups that allow youth to learn how to support each other's mental health and well-being. This is critical for multiple reasons. One, as we know, the mental health of our children, our adolescent and teen children, is very vulnerable at this time in the age of social media and all the things that are happening in the world. So it's important on multiple levels that there are multi-tiered levels of support within the school system to support this. But what it also does is it gives young people an opportunity to learn and practice and see positive outcomes from the skill. And often it's those little moments of practicing that can develop into a lifetime passion or a why for them, something that they believe that they can make a difference in the world, and they can pursue that, and it can be sparked at such an early age. And then offering mental health services in school settings or connecting them to counselors that create that lasting impression. Often we know that the field is divided and there's opportunities within the school system for guidance counselors, but I've heard from many guidance counselors that there's not a lot of space or safe space, as Dr. Cam was talking about, to have some of those very necessary or needed conversations with young people in the school setting. It's often looking at maybe testing or some of their critical needs in the moment, but not necessarily a therapeutic level of support. And the reason why this is important at the middle school and high school ages is because how often is it that when we've had a positive experience from someone has offered a service or delivered an outcome that has supported us, has that led us to say, you know what, I want to do that. I could do more. I'd love to learn more about that. And so one of the best ways to do that for a child or a young person is to be that for a child or a young person, to kind of spark that initial interest and know that people in the world do this as a profession and it exists. So as we talk about viability and how we're making sure that young people even find interest in coming into the field, something that's very critical, especially here in the state of Florida, is making sure that we offer and advocate for the offering of competitive wages in the field, and expand on the opportunities that it allows to become an entrepreneur. And so this is just an example. In the state of Florida, Florida ranks 50 out of 50. As to the lowest rate of pay in the field of mental health counseling. So nationally, the average is around 75,000, and Florida is sitting at about 55,000. And so as we're telling young people that this is something that that may be a viable option for them, we also need to make sure that it is competitive in pay as they're looking at all of the levels of funding and education that are required to be in the field, not to mention some of the credentialing, testing, and all the costs that are associated with maintaining your licensure and other credentials in the field. We need to be advocating for competitive pay. So as Dr. Cam spoke a little bit about, I wanted to spend some time talking about disparities in BIPOC with BIPOC service providers. And so here in Tampa Bay, Florida, in St. Petersburg, we have an organization called the Foundation for a Healthy St. Petersburg. And in 2023, they completed a mental health landscape scan across the scope of Pinellas County. And what they found in that scan is that racial concordance with mental health providers is highly desired by BIPOC patients. Clients and patients want to have individuals that look like them, that understand them, that through all of those intersectionalities, that there is that likeness, and sometimes across multiple sectors, right? And so data shows that BIPOC are underrepresented among mental health providers nationally. Now, some of the barriers to this may include racism and discrimination. And so that can be on all levels, right? So that can be as they navigate in the world, it can be as they're speaking to their the influential individuals in their life as they're young people growing into adulthood, thinking about what do they want to major in, as school systems are impacted and that representation is minimal there in the classroom, not seeing individuals in that space that maybe look like them. And so that is a multi-layered point. Bias. So what we know is that there's some standardized testing that's required for social work as well as for mental health. And what we know about standardized testing is that bias exists within those tests. So it is already challenging, I think, a rate of under about 50%. So about half of the individuals who take these standardized tests do not pass on their first try. So when you break that down and take a look at BIPOC practitioners, that number is even lower as in regards to a pass rate. And so there are things in place. There is a sensitivity and bias review committee that has been put in place that takes a look at the language, the content, to determine if there is any identified bias. And there have been some recent shifts to the test, but it is something that we do need to note that it does exist. Funding. So as populations are marginalized across the board, this can make some of these other barriers even more sensitive and critical. The cost associated with these trainings to be skilled providers can be quite costly. Credentialing to maintain is quite costly. To become a registered intern, to pay for your licensure and licensure exams. So thinking about the disparities across the board and how then that may impact being able to invest in some of the necessary requirements to be able to practice or work in this field of work as a barrier. Another barrier is the lack of BIPOC faculty in the counseling education field. And so as we were thinking about how important it is for our middle school students as well as our high school students to see representation, we think about our young adults who are in college and their access to having faculty and staff that look like them. The most recent Council for Accreditation on Counseling related to educational programs statistics reported that there was an overrepresentation of white faculty, 71% compared to the 60% of the US population. And so what that tells us is that individuals, even if they make it through the threshold of getting to college and considering this field, when they get there, will they be met with educators that look like them? Not to mention the layers of toxic environment and all of the other factors that Dr. Cam spoke on. I'm not even going to speak to some of the challenges and pushback in certain states. I'm in Florida, so there is a lot of current stress around the topic of DEI and what can be taught and discussed in the classroom. And so with all of those factors and the lack of representation, it's continuing to be a barrier when we look at the disparity. And so what can organizations do to improve their organizational culture? We want practitioners to come to our organizations, to our businesses. And so we want to make access easy. We want to be intentional about the recruitment of diverse providers. And we want to make sure that when they get there, they are offered a competitive pay and incentives. This is, I did not mention before, but this is also critical because we know that there is a national shortage. What happens is the competition increases. So nationally, across the board, there's a shortage. And so that means that if in Florida, a starting salary is $55,000, but there are also these telehealth and virtual options, and a practitioner can work from home, but provide services in another state, they may be offered double their salary. And so what that does, while it does allow for that practitioner to have a livable and necessary and deserving rate of pay, it further limits the access, especially for BIPOC providers in the communities in which they serve, which we know it's critical. And so having to take a look at that and look at the scope of that across the board. Once they get in the door, it's important that we do whatever it takes to support their ability to thrive. What I have heard in the field is that practitioners want to have access to trainings and trainings that they can carry with them. When we talk about professional growth opportunities, it's critical that when we train our providers, it is not in a means to own their work, right? So once you learn something, it goes with you. When we improve or give access to trainings and knowledge and resources, we are bettering the field as a whole. So we cannot look at how to hold that in within our individual organizations. While it is tempting to do so, it is important to know that that clinician or that provider can thrive in any setting and be available to offer the necessary supports to the community. And ensuring that there are culturally attuned practices within our organizations. And that may take some of that challenging of the system, the challenging on policy and power that we know is very critical when we want to look at what is culturally attuned. And then improving that desire to stay. So we want to make a work environment where individuals want to be there. And what would make them want to be there, other than the things that we've talked about? Professional growth opportunities, right? Where can this career lead to? And meaningful impact. I think when we look at the disparities in pay and what individuals across the board in the helping field make, what is most valuable is that connection to being meaningfully impactful in the communities in which they live and serve. And so finding what that impact may be within the individual and nurturing that. And so for my takeaway, I know that often individuals and organizations are saying, well, what can we do? What can we do to help? It's really important that we join forces, that we combine and further our network. And so an example of that is supporting local and national BIPOC behavioral health organizations that are doing the work. So at my introduction, I mentioned that I was a member and the board chair for an organization called The Well. And The Well is located in Pinellas County, Florida. And it is a BIPOC healing space that prioritizes the need by leveraging the strengths of BIPOC. Not only do we serve in community and celebrate in community, we are also there to meet the ongoing needs of practitioners and those that are doing the work through connection, networking, training, access, empowering, elevating. And so it's really important that I'm pretty sure that we're not the only organization that does that, right? So as we're thinking about what can we do to take action, looking at your local organizations that do this work and supporting them so that they can further grow and lead the charge. So I'm ending with a quote, and it says, "The best way to find yourself is to lose yourself in the service of others." And that's Mahatma Gandhi.
Thank you so much, Russia, for sharing that and for really placing emphasis on the importance of modeling the way. And for people, young people especially, to see themselves and to be able to see themselves in these careers and see themselves thriving. And also the importance of investing in things that reduce the barriers or hopefully eliminate those barriers to testing, barriers to having a thrivable wage, barriers to being successful in your skin in the workplace, and the importance of, I'm biased to it, the awesome work that the Well is doing here in Pinellas County. And not only the work that they're doing, that you all are doing there, but also how it can create connection. So if someone has an organization that is predominantly Caucasian and you want to support your brown and Black staff, connecting with organizations like the Well, where people can see themselves and they can learn culturally engaging practices and how to have a better rapport with their clients, but also gain that network of support that they can relate to and that fills them and helps them to be able to do their job better. That's very important. And so thank you for sharing that. All right, so just to go back, I'm excited again, so excited. So we had Dr. Doc Weiler, who talked about the importance of action and active action and shared with us their artery program that they're working on, but just starting. I think that was a key takeaway, just starting, that sometimes it probably feels like a big ball of yarn or that bubble gum that keeps getting bigger and bigger as you chew it, but just starting, finding a place and starting and being active in it and taking action. And what comes up for me is something that I always say about diversity, equity, inclusion, that diversity, equity, inclusion is, and it does, like there has to be some receipts. And I think Dr. Cam, you spoke to that about those receipts. Like, how do we engage with intersectionally diverse staff, students, and faculty? And we can't just talk about it. We have to look for equity and excellence that both come together, that equity is, and it looks cute on our boards, it looks cute in our handbooks and those little statements that we put on the wall, but what does it do? Where are the receipts at? What is the impact that it's making? And really looking at the foundation of that, how do we create a place that people even want to come to? And we interrogate and challenge those policies and looking at how do we recalibrate power? How do we recalibrate decision making and making sure that everyone is able to thrive in those institutions? And then Russia, touching on modeling the way. I thought that was very powerful with the story that you shared about a lot of times we're modeling the way and we are the biggest recruiters of our careers and of our organizations, and we're modeling the way and people are watching, young people are watching, and we don't even know. And so what does that look like for them? Does it look like something they would want to be a part of? How has their experience been so far? Because if I don't have a good experience, there's a chance that I'm probably not going to be interested in it, or I may be because I want to make a difference. And so how do we create an experience where young people want to come, where they're able to come and be innovative, where they're able to come and be their full selves, and also addressing those barriers? So we want you to come, but we don't want you to have to eat beans and bread every night unless you want to. So how do we create a thriving wage in addition to engaging with people in their communities? And so I will pause here. I know we have a short break before we have our after party, our question and answer session. So we'll pause for about 2 minutes for a stretch break. In the interim, if there are any questions that you would like to present to our panelists, they will be here to answer your questions. If there are thoughts or things that you're working on within your organization and you find yourself at a place of stuck, we have some brilliant panelists here who have done this work and who are able to kind of serve as a thought partner alongside you as you're doing this work.